All pharmacy schools are going to require a certain number of units or a certain number of courses in the sciences. So we're talking about organic chemistry, we're talking about general chemistry, biology, perhaps anatomy and physiology. These are common prerequisite requirements for pharmacy school. Those classes have to be taken in college. So as a high school student, the best way that you can take classes in high school to prepare you for those college level courses that will be required by a pharmacy school are in those subject areas that you're going to have to take. So again, chemistry, biology. Those certainly will prepare you to do better once you get into the college level classes. Some schools do also accept advanced placement or AP and international baccalaureate or IB courses to fulfill prerequisite requirements. So if you happen to have that as an opportunity in high school, you may want to consider that to be able to take some of those courses at the high school level that could be counted towards prerequisite requirements for pharmacy school. Once you're in college as an undergrad, what you'll want to do is pretty much follow a pre-health track. Most pharmacy schools require very similar prerequisite requirements, although they all slightly differ. A great resource for you would be the school directory pages on the PharmCAS website that allows you to see what every school requires in terms of their prerequisite requirements. Again, it's going to be a lot of science, math, subjects that will really be pertinent and valuable for a pharmacy program. Those are going to be required. But it's also important to note that non-science classes could also be relevant and important as well, and most pharmacy programs also require a set of non-science classes, things like communication, psychology. Those are important too as you begin to pursue a PharmD degree program. One of the things that you should do is once you're in college is begin looking at PharmD programs to begin to sort of narrow it down what programs you might be interested in, and then take courses that are going to be able to satisfy the requirements for those programs. And again, it's a little bit different for every PharmD program, and so you want to be aware of the courses you're taking. Finally, sometimes it's not always possible to take all of the courses at the undergraduate college that you're attending, so it's very common for pharmacy students and applicants to take prerequisite courses at community colleges or other institutions that aren't part of the primary institution they're attending. The best way to sort of attack this requirement area is to contact the pharmacy school that you're interested in to get a little bit more information about what they require. I'm often asked what type of pharmacy or healthcare experience should an applicant have? And it's a hard question to answer because there are so many different experiences that could be relevant to a student applying to pharmacy program. Obviously, having direct pharmacy experience provides a level of insight into the profession to give that student an idea of whether or not pursuing a PharmD degree is the right path for them. But I really want to emphasize the idea of having insight, and that's a little bit different than experience. And insight is where you, as an applicant, really kind of utilize all the different resources available to get some insight into the profession. And for some, that may be through direct pharmacy experience. But for others, maybe that's being involved in a pre-pharmacy organization. Maybe that's having informational interviews with a pharmacist. Maybe that's working in some area of healthcare that may not be directly pharmacy related, but has provided them an opportunity to get a little bit of insight into the pharmacy profession. I think it's safe to say that no pharmacy school wants to admit a student who has absolutely no idea about the role of a pharmacist in healthcare. So any type of experience that you've had that has provided you with some insight into the profession can certainly be valuable, even if it's not direct pharmacy experience. It's really about researching the career paths, really having a solid understanding of the role of a pharmacist on the healthcare team, understanding the landscape of the health professions in general, understanding healthcare landscape as it relates to different patient populations is certainly important. COVID-19 presents a lot of challenges for many applicants because they're not able to get direct pharmacy experience, and that's okay. Most pharmacy applications are asking how has the pandemic impacted your ability to have these types of valuable experiences or to get the insight that's important. You should take advantage of online resources to get that information. It shouldn't be the case that because the pandemic has really impacted all of our lives that you are not continually learning about the profession, not continually doing everything possible to get as much information as you can, so that when you apply to pharmacy school or you're interviewed by a pharmacy school, you really understand what you're getting into. Nobody wants to admit a student who is in a program and that decides, you know what, I don't think pharmacy is the right path for me. What we're probably going to do is go back and look at the application for admission and see, where did we go wrong? Where did we see that this student really didn't have enough information on the pharmacy profession? In many ways, it's no different than if you were applying to law school or art school or business school. All of the disciplines are going to want to see some type of experience or insight into the particular discipline to know that this is the right path for you. And that's really what you want to demonstrate on an application and in an interview. Most applicants are obsessed with their GPA and grades, more so than pharmacy schools are. Performance in your courses in college are oftentimes a good indicator of whether or not you're able to transition and be successful in a doctoral level curriculum and program. I don't think any pharmacy school is automatically going to admit a student simply based on their academic performance. There are so many other characteristics that schools are looking for. Communication skills, your experiences, both your work experience and your extracurricular activities. Your letters of recommendation are certainly important. The academic piece, your GPA, your grades, are a small piece of a very, very large puzzle. So it's not everything. There's so much more to who you are. I challenge you not to get bogged down on GPA or your past grades. I always tell students to focus on the present and the future. So if you have had a rocky academic past, there's nothing that you can do except to do well in the courses that you're currently enrolled in or the courses that you plan to take. If you're ever concerned that there may be red flags in your academic past, maybe you didn't have a great semester or quarter, or maybe there's that one subject area that you were really challenged with and you had to take multiple times, or even have a W on your transcript, utilize the essay opportunities in the application to discuss it. And that's simply what we're looking for, is to put into context what was happening, what were you challenged with, and that really allows us to paint a complete picture and, again, put all the puzzle pieces together. I encourage you not to get focused on the GPA, but understand that there's so much more to an applicant, so much more to an application besides just the academic piece. Finding the right pharmacy school is an essential and critical piece of the application process. You don't want to apply to every program. You want to narrow your choices down to those schools that you think you can be most successful at. You have to research every program that you're considering to make sure it's the right fit for you. Carve out quality time to learn about each program. Learn about the curriculum. Learn about what makes each school unique. There are going to be a lot of similarities that you'll start to discover, but of course, there are many differences as well. You really, really need to take the time to do a lot of research, and the best place to do that is online. Each school has very well-developed websites. They're going to provide you with a lot of information, answer a lot of questions you may have. Take advantage of participating in virtual fairs. Right now, that's what we're really engaged in, and having a chance to interact with a lot of prospective students and applicants. When the pandemic's over, we'll have a chance to meet again in person through graduate school fairs. Again, this is a great opportunity for you to meet with representatives from each program to ask questions, to get a better sense of whether or not you would make a good fit for that program. Don't be afraid to reach out to pharmacy programs. I know a lot of students are intimidated by that opportunity, and don't. Really reach out. many schools are available and willing to answer questions, perhaps get on a phone call or a Zoom call to be able to engage and be able to make sure that you get the information you need to determine whether or not this particular school is the right fit for you. Finally, one of the things that people don't often do, but I think is really critical, is learn about the city where that school is located in. So that's really important because you're going to be spending 3 or 4 years in that particular city pursuing your doctoral degree and really appreciating the city that you live in, understanding what the opportunities are in that particular city or what it's like to be a resident there are going to be key decision-making factors in determining whether or not a school is right for you. So learn about the curriculum, do your research, but also learn about the city the school is located in.
The very first question that you may have will probably be about the classes and prerequisites. The question that you have along with those would be, do I need a pre-pharmacy major or a chemistry major in order to apply to pharmacy school? I'm here today to tell you that the answer is, it depends. It really depends on the school that you're applying to. The best thing that you could do as a student who's interested in becoming a pharmacist is to look at the school's admissions page website. On the admissions page website, that'll give you all the necessary information that you need to figure out what steps you need to take in order to becoming a pharmacist. You can also, which is something I highly recommend, reach out to the admissions team at the school you're planning to apply to. They'll be your best source of information when it comes to what you should do in order to become a pharmacist. So, you've had the question answered regarding what classes you need to take, as well as if there is a specific major in order to become a student pharmacist at your school of choice. Now, the next question you have is, should I become a pharmacy technician in order to gain experience? Well, I'm here to say, if you have the opportunity to become a pharmacy technician, the answer is yes. Being a pharmacy technician is a great way for you to gain a high-level overview of what a pharmacist does, as well as being able to be in a position where you're working alongside other healthcare providers. For instance, hospital pharmacy will place you inside a hospital health system where you will be delivering different types of medications as well as compounding sterile medications and delivering them to different units. Community pharmacy will be a different type of exposure of the world of pharmacy for you as well, where you'll be working alongside a pharmacist who is easily the most accessible healthcare provider in the field of healthcare. So, if you have the opportunity to become a pharmacy technician, definitely do it. You can become certified as well. However, if you do not have the opportunity to become a pharmacy technician, do not worry. You should also look into ways that you can volunteer at a local pharmacy or shadow. Those are some great opportunities for you to gain experience and as well as being able to learn from other pharmacists. All right, question 3. Do I need a bachelor's degree before applying to a PharmD program? Well, the answer to this question is, it depends on the program that you're looking to apply to. There are some PharmD programs that require students to have their bachelor's degree, and then there are some other PharmD programs that require for you to have at least a certain amount of undergraduate college credits completed. The best thing for you to do as a student looking to gain entry into a school of pharmacy would be to, again, look at the admissions page website. The admissions page website on the school of your choice will have all the information needed for you to understand what steps you need to take to become a student pharmacist. You can also look at AACP's website, as they also have a list of all of the school's requirements. All right, so you made it to question 4. What can I do with a pharmacy degree? Well, I'm here to tell you that your options are truly limitless. You can go into a community pharmacy, which will place you either in a rural setting or in an urban setting. Being a community pharmacist means that you'll be one of the most accessible healthcare providers in the world of healthcare. Then there's also independent pharmacy. So say, for instance, you would like to own your own pharmacy chain. Then moving forward, there's hospital pharmacy, where oftentimes the clinical pharmacists that you see inside of a hospital have gone on to a residency. What does a residency mean? Going to a residency means that you have the opportunity to specialize in an area of pharmacy. This area could be something such as pediatrics or emergency medicine. Then there's academia. Being in academia means becoming a professor of pharmacy or becoming a dean. Who would not love to do that? Now, there's also industry or pharmaceutical research. Pharmaceutical research is a great opportunity for you as well as a team of other scientists to work on the next and best medication to help move our healthcare forward in this country. Last but not least, there's government. There's government agencies where pharmacists are needed, such as the FDA or the CDC. So again, those are just some of the areas of pharmacy that you can go into. The opportunities for you are truly limitless. I hope I've been able to answer all of your questions today. Again, if you have any more questions, please listen to the rest of the answers.
Where students take their prerequisite courses is a question that I often get. So I want to take you behind the curtain from an admissions perspective. The questions that really need to be asked is not what the minimum requirements are, but rather what does a competitive candidate look like? The letter of the law versus the spirit of the law. So pharmacy student, your courses will all be science related, and the admissions committee wants to see that you'll be able to handle the rigors of the program. The best way to demonstrate this is by having a transcript that shows robust semesters where you've taken multiple sciences and in a competitive environment. While most colleges of pharmacy do not require a bachelor's degree, it's clearly preferred. So pharmacy school is very demanding. There's a great amount of material that you have to master and retain. So while you complete your prerequisite courses at a community college, competitive candidates may want to consider completing their advanced science requirements in a more academically rigorous environment. But there's also before the fact and after the fact. So if you come to a school after the fact and you've completed your courses at a community college setting, you do not need to retake them and go to a four-year program, four-year college or university setting. You just need to have strong, stellar grades. You need to have robust semesters, and you need to have just done well and really have a strong transcript. Colleges of pharmacy like to see that a student has some sort of shadowing experience or exposure, have demonstrated some sort of work commitment to the field of pharmacy. In more typical times, you'd be able to reach out to your community pharmacy chain or the independent pharmacy and speak with the pharmacist to discuss shadowing opportunities at the store. If you're interested in shadowing in a clinical pharmacy setting, you can contact your local hospital, inpatient or outpatient setting for shadowing opportunities. If you can only obtain a hospital volunteer opportunity, then while you're at the hospital, be bold, be creative, make your way to the various pharmacies within the hospital and meet with the various pharmacists to try to get some shadowing experience. However, during COVID-19, interested students have a harder time. They find it more challenging to find shadowing opportunities. So instead of shadowing, you might be able to have one-on-one conversations with clinical pharmacists or retail pharmacists where you can ask them questions about their profession, what they actually do, the skills that they think are important and necessary to succeed, and perhaps what their pharmacy school experiences was like. Either way, you have to be proactive. You have to seek out these opportunities. But the great news is that pharmacists are the most accessible healthcare professional, so you can just pop into your local chain or independent pharmacy in your community and speak to the pharmacist directly. The important role of the essay is to give admissions committee a sense of your personality. What kind of addition are you going to make to the school's community? Basically, the essay contextualizes your application and shows what kind of person you are outside of your grades and test scores. The personal essay is your opportunity to share your passion for the profession, demonstrate how you are equipped to complete pharmacy school, and how you plan to impact your patients and the profession as a whole. The essay is the only part of your application where you get to tell your story. It needs to be thoughtful, well-written, and there needs to be an emphasis on the important things that you want us to know. Since your personal statement, along with your letters of recommendation, can reveal your character more clearly than other application materials, they may provide evidence that you bring something distinctive to the profession, an unusual ability, background traits, experience, or your unique way of looking at the world. A creative or moving story will be remembered by the reader. It tells a story in a way that explains your desire to pursue pharmacy. You do not have to have succeeded under adverse circumstances to have a compelling story to tell. You could have been inspired by an individual or an experience. I will give you a piece of advice that I give to everybody. It's very difficult to approach writing the essay. It's easy to procrastinate. So when you look at the essay prompt, think about the things you want to write, create an outline. Bring this outline to your writing center if you're still in school, if you still have access to the writing center. Once that it's been determined that you have all the points covered, then sit down and use your outline to actually write the essay. You might want to bring it back at the end to your writing center to see if they feel that this is a finished product. And I would recommend having a healthcare professional, preferably a pharmacist, review it as well, because they'll give you a really great and unique perspective. Most important, my recommendation, your personal statement needs to be genuine. It needs to be your story. I'm often asked, what's the difference between a pharmacist and a pharmaceutical scientist? So pharmaceutical scientists can be found in industry, in the lab, in academia. They're expertly trained to discover, develop, test, and manufacture new medication. This includes the study of the formulation, the development, and the manufacturing of them. Now, pharmacists can be found in those very same settings, but they are also found in many other healthcare settings. Pharmacists are highly trained to evaluate medication use, which medications to prescribe, dosage, drug delivery, and they are communication experts. They will communicate with other healthcare providers and their patients. They'll prepare and dispense medications, and they'll educate and counsel their patients about their medications.